If you're the right patient for LASIK, I think it starts with answering the question, do you want to be less dependent on glasses or contacts? We treat patients from as early as age 20 all the way into their 60s. Some have large prescriptions, some have small prescriptions. Some patients are not tolerating contact lenses as well. Some patients will notice the glasses simply are fogging up in the winter months.
It's a very liberating experience, and it really is transformative. It changes people's lives because they can now do more and they're not dependent on those devices. But the decision to have surgery depends on what you need and what you want and if you're qualified.
And the best way to find out is by having a free LASIK evaluation. What that entails is an examination of all the structures of the eye with special focus on the cornea, looking for dryness of the cornea, any astigmatism or irregular astigmatism, and measuring the thickness of the cornea to make sure that they're a good LASIK candidate.
We can use LASIK surgery to correct farsightedness, nearsightedness, and astigmatism.
Many people think that we really can't treat astigmatism, but we can treat up to 6 units of astigmatism, which is just about anybody.
One other ocular condition that we focus a lot on is dry eye. There's somewhat of a misconception that patients with any sort of dry eye symptoms cannot have LASIK surgery.
If patients have a little dryness when they wear their contacts, oftentimes we ask them to stay out of their contacts for the LASIK evaluation, and over the days to weeks that they're out of their contacts, their dryness goes away.
And if their eye's extremely dry, pathologically dry, let's say, then we don't want to do LASIK because sometimes that causes some problems.
There are some patients who are not candidates for cornea-based refractive surgery. It's possible that their cornea is too thin or may have some tendency to have an irregular shape.
You're not really a good LASIK candidate if you're not in good health. If you have an autoimmune disease like arthritis or lupus, those kinds of things tend to make exaggerated healing responses. You may have healthy eyes and they may be fine, but you're just not LASIK eligible.
Oftentimes we have alternative refractive procedures that we can offer, such as PRK or photorefractive keratectomy.
We can utilize an implantable contact lens. This is a lens that slides in between the patient's natural lens and the iris. And this can give very similar outcomes that one receives with LASIK.
Tried to think of everything we can do to make sure that you feel welcome and at ease, and to determine whether you're a good candidate or not.